A single missing tooth seems like a minor issue, but its consequences run deeper than the surface. That gap is a signal that your jawbone is at risk, which can permanently alter your facial structure. While some solutions just fill the space, one option actively preserves your bone and protects your other teeth. We're talking about the single tooth implant, a solution that is a total restoration, not just a replacement. In the next few minutes, we'll break down the procedure, reveal the science, and show why it's the gold standard. So, aside from saving bone, how does an implant affect your daily life? Let's cover the 3 biggest functional benefits. First, they look and function exactly like a natural tooth. The crown is custom matched to your smile, making it undetectable. Second, they restore 100% of your chewing power and can correct speech issues, like a lisp caused by the gap. Third, care is simple. Brush and floss just like your other teeth. What's more, an implant can never get a cavity. Unlike bridges that may last 10 to 15 years, implants are designed for permanence. With proper care, they can last a lifetime. But how can an artificial root last so long? The answer lies within a remarkable biological process. The secret is a process called osseointegration. This is where biology and material science merge to create a permanent bond. The implant's titanium post is biocompatible, so your body accepts it. Over months, your jawbone naturally grows onto and fuses with the implant. Why does this fusion matter? It allows the implant to transfer chewing forces to the jawbone, giving it the stimulation needed to stay healthy. Recall how we said a missing tooth puts your facial structure at risk? Osseointegration is the process that actively stops that from happening. This is the critical difference. Bridges and dentures sit on top of the gums and don't stimulate the bone, so resorption can still occur underneath. The science is impressive, but what about the actual patient experience? Let's address a major myth about the procedure. Many people fear the surgery will be extremely painful. Yet, most patients report it's less uncomfortable than a tooth extraction. The process involves placing the implant, a healing period for osseointegration to occur, and then attaching the final custom crown. Recovery is manageable and vital for success. It involves a soft diet, careful hygiene around the site, and avoiding smoking to ensure proper healing. Modern technology like 3D CBCT scans and computer-guided surgery makes the process safer and more precise, leading to less trauma. This all sounds effective, but what if you've been told you aren't a candidate? What if you already have bone loss from a long missing tooth? For many, existing bone loss is not a disqualifier. Advanced procedures are available to rebuild the necessary foundation. A procedure called bone grafting can add bone material to your jaw, creating the solid base needed for the implant to integrate successfully. Another myth is that implants are only for a certain age. In truth, your overall health and jaw development are what matter, not your age. And material science continues to advance. While titanium is the standard, options like zirconia offer a metal-free, highly aesthetic alternative. We've seen how they work and who they're for. But what is the single biggest mistake people make when they have a missing tooth? The biggest mistake is waiting. Doing nothing is not a neutral choice. It starts a cascade of negative consequences. As we've discussed, waiting leads to bone loss. It also causes adjacent teeth to shift, creating bite problems and increasing decay risk. These bite problems can lead to chronic headaches. In the upper jaw, the sinus cavity can even expand into the space where the tooth root was. Here is the ultimate takeaway. All of these consequences make the final solution more complex and expensive. Waiting actually increases the final cost. A single tooth implant isn't about filling a gap. It is a proactive investment in preserving your entire oral health and facial structure. And it's an investment with a proven record. With success rates consistently between 95 and 98%, it is a highly predictable procedure. It stands alone, supports itself, and protects the healthy teeth around it. It is the only solution that truly mimics nature's own design. If you have a missing tooth, don't wait for the consequences to unfold. Consult a qualified dental professional to see if this is right for you.